It's about understanding the culture of where the patient comes from.
The core layer of communication, the second layer of documentation, and the third layer.
But it's very, very important that these are only prescribable on a video consultation, not on an audio consultation. So audio,
There are asynchronous type of telemedicine consults. There is synchronous.
if it's a minor, it's very important that you doctor to a paramedic to a patient, and doctor to multiple doctors also.
16% to 17% of the entire consultations.
Telemedicine practice guidelines have to be a part of the education curriculum, for which Telemedicine Society of India. Cutting through the noise in this information overloaded era that we are in, we are bringing something specifically curated for doctors. These topics are usually not taught during our medical education, but are very critical during our medical practice. So we are bringing these conversations for you. Please make sure to follow Augsidius channel, like this video, and share it with other doctors who you think would benefit from these conversations. In this specific video, we are going to cover the topic of telehealth, starting from the fundamental definitions revolving around telehealth and telemedicine to the regulatory aspects, covering past, present, and future where we are heading towards. So let's discuss about the important topic today, which is telehealth. On one side, there is stigma that is going around in practicing telemedicine, because the industry says that a lot of telemedicine companies are dying because they were not able to achieve any significant business model that can be learned from and be implemented. On the other hand, we are seeing significant benefits from practicing telemedicine. So because for the newer generation who are completely practicing digital modes for everything nowadays, I think it's important that we also talk about where does healthcare see telemedicine or telehealth, and let us discuss about that topic around today.
Yeah, I think there is definitely a lot of disappointment or a lot of hype and fall of the trend related to telemedicine that happened in the last, and there is a very good reason for that. I think we all know whenever you talk about telemedicine, everybody talks like pre-COVID, COVID, and COVID, post-COVID kind of eras for telemedicine. And when we talk about telemedicine, it's all about one of the major things that it breaks is distance. It is distance agnostic, more or less. So I think during COVID, it was a need of the hour. Anything that can actually antagonize or go against distance related challenges, that was needed. And that actually caused a massive wave of usage of telemedicine, awareness about telemedicine. And it was highly likely to drop after that, because the whole challenges that were with COVID came down. And post COVID, that's the reason I think telemedicine was not seen as effective as it was supposed to be, or and all that. And that correction is always a necessity, or that is always a necessary correction. Not just telemedicine. I think as a law of hype cycle, everything goes on suddenly rapidly increases like a viral trend. Then it slowly comes down or rapidly comes down in some cases, and afterwards it plateaus at a certain point of adoption. And that is the realistic adoption. Here on, it will slowly grow, organically grow, and that's the phase we are in, and that's a very good phase, I think. So what do you think in terms of, was there telemedicine pre-COVID? Because lot many people know that telemedicine is an aspect that can be impactful only after COVID happened. But what do you think was pre-COVID of telemedicine?
I think I would say that I was kind of lucky enough that I was able to experience what telemedicine was before COVID also. That has actually helped me in terms of adopting and propagating it further during the COVID, when there was the lockdown, the accessibility gap was there. And post COVID, I have seen how the practices have been changing as well, right? So pre-COVID, it was mostly in the experimental phase. Telemedicine model itself was experimental at that point of time. There was, there were centers that were operational exclusively as a telemedicine only companies. Um, there were no presence of doctors in that health center. A health center was called a health center because there was a healthcare service being provided, but we have seen doctors not being present in those health centers, but patients benefiting from it. Now that doesn't mean that the doctor's expertise is negated totally from the equation, but we have actually figured out how limited accessibility of those doctors by empowering the other healthcare professionals like nurses, nursing practitioners, lab technicians, and ANMs and GNMs. These kind of support healthcare professionals were serving as the facilitators of telemedicine, and they were taking in the advice from the doctor. They were being guided by the doctor being present, and ultimately the patient was getting benefit from it. This was something that we have witnessed before COVID.
Okay, so there was actually successful implementation of telemedicine even before COVID.
Absolutely.
Yeah. So yeah, that's the point I think I was trying to establish, and it is maybe important to clear out the whole confusion between what is telemedicine and what is telehealth, and why are they used so interchangeably. So just for people who are comparatively new to this topic, I think it is very important to understand that telemedicine is any interaction between a provider and a patient which happens uh, at a distance, kind of a thing, using technology, where there is exchange of medical information, advice, or any clinical interaction that can happen. All of that can come under telemedicine, mostly clinical in nature. Telehealth, on the other hand, I think is more broader in nature, where it also encompasses the training, the administration related, the economics of how telemedicine interactions happen, what happens before that interaction and after an interaction. That whole thing encompasses. So telehealth. So telemedicine is the core interaction, and the umbrella around it, I think, is telemedicine. That's what
Telehealth.
all of us need. Telehealth. All of us need to differentiate and remember. So that is, with that out of picture, when we say telemedicine again, what do you think are different types in which telemedicine can be conducted, and what is the like ups and downs, or what are the pros and cons of each one of them?
So I'll pick up the terminology that's been mentioned in the telemedicine practice guidelines, and will keep the discussion around it so that it will also create that awareness about those guidelines, why they were formulated, why they were released during a very crucial time of COVID. In fact, I would like to place it on this discussion also that it was supposed to be released a bit later in the time, but we had to release it. I mean, the government has released it during the COVID because of the huge requirement or the necessity
Correct.
that they have seen, right? So we'll pick the terminologies from there. The first, it is asynchronous mode of consultations. Asynchronous means that the communication is not happening real time. So the store and forward kind of method, which means that let's take a lab report for that matter. Lab report has been conducted. That report has been shared with the provider, and the provider views at a different point of time, gives his interpretation, and that report comes back to the patient.
I think a lot of radiology is happening that way.
Yes. So tele ECG is one of the surveys that way. Teleradiology, telecardiology in certain matters has utilized this. There is telepathology also, which is a very evolving field of late, which utilizes. Yes, there are also dermatology related companies where a skin lesion is scanned and that image is forwarded as well. So whenever these kind of transactions happen, it is called as an asynchronous method. Now coming to synchronous or a real time. Real time, it can be different depending on the mode of communication again. There could be an audio consultation only. There could be an audio video consultation. So there are limitations according to all these different modes of
Communication.
communications, and what the limitations that a doctor needs to understand and practice, and a patient needs to understand and be aware of, so that both of them, who are very crucial in this whole equation of the healthcare, are not facing any challenges at a later point of time. So that being said, um, maybe you can throw some light on where do the technology come into play in this picture, how the facilitation of all these more different
Mhm.
possibilities is happening with the technology in coming into the aid.
So I think prima facie telehealth is built around tech for that matter, because when it is on the distance, the communication, the networking that needs to happen there, you need some kind of a tool or a platform where that video is streamed back and forth, or audio is streamed back and forth, and text is being back and forth. Usually everybody sees that is the only requirement, kind of a thing, that you need to get started on telemedicine, or if you're a tech provider, that's the only thing that you require to get started. But there are many more bells and whistles that are attached to the tech around telemedicine. The reason is that with the limitations of telemedicine, the tech can fill some of those gaps. What I mean by that is, the history is something that is, very much crucial in when it is a telemedicine. It's crucial in both the physical consultation and tele, but because there is no examination and there is only or mostly history collection.
Hmm.
So how do we capture that? What is the scribe or what is the EMR that is being used to capture this data, and not letting any of the crucial information during that conversation be lost? That is also necessary to be focused upon when we think about the platform for telemedicine.
Hmm.
Other than that, I think if we come a layer out, if the core is communication, the next layer is documentation. The outside part of it is where the current magic is happening, which is all about the tech associated with remote monitoring devices.
Hmm.
Vitals have to be checked. There is, on the other side of the consultation, or on the other side, on the patient side, if they have certain devices, if they have certain medical devices that can actually stream these vitals, that can
Hmm.
stream these parameters, that can do non-invasive kind of monitoring, or non-invasive kind of biomarker measurement, and send it to the doctor. That's the uh, very much value add, and
So
this layer
hmm,
blurs the difference between physical and the digital.
if I may just mention there, I think that's what we are talking about, telehealth layer, right? Which is also bringing in the observational part of it, where what the physical examination usually does, the physical presence usually is
I
required.
think it is still part of telemedicine. Telehealth is all about, how are you equipping the rest of the pieces, when we talk about the
Education of the
logistics,
patient.
the education of the patient, the logistics. There is remote awareness sessions that are connected, that not might directly be a physical one-on-one clinical interaction, but
Hmm.
it is still being used by remote modalities and still focused on, yeah, bettering an individual's or a community's health.
Hmm.
So that whole thing encompasses telehealth, and the tech required for that is again a little different.
Hmm.
What these three circles I'm talking about, the core layer of communication, the second layer of documentation, and the third layer of vital or biomarker measurement related layer, these would be for telemedicine point of view. So I think the strides are changing in every aspect of it. So simple example being, on the communication layer, with the whole new AI models that can translate across 1700 different languages. Meta recently released a Omni language translation, or a speech to text kind of a model
Hmm.
that, surprisingly, which is open source and works across 1700 different languages, all of the remotest languages that many other models don't address were being addressed. And that one simple aspect can change how we communicate in telemedicine, and what can be the impact of telemedicine. Simple way, somebody who is speaking Telugu doctor,
Hmm.
they can speak to someone who does not. It might be a tribal kind of a very limited landscape knowledge, but still is able to convey, removing that language barrier. So there is innovation that is happening across the
Yeah.
spectrum.
Picking up from where you mentioned about importance of the language, and I would also like to talk about a little bit about the regionality aspect of it and how it is essential. Forget about calling it as a part of telehealth, because I think that the tele word is almost becoming obsolete now. It's care, right? That as a uniform entity, whether it is in person or whether it is through telehealth, is that is what is kind of becoming the new reality at this point of time. So picking up on the regionality aspect, when we were working on a project with Jharkhand, this was very crucial element that we had during our discussions or training sessions of the doctors, right? It's about understanding the culture of where the patient comes from, what is considered normal there, what is considered abnormal there.
Very important,
It
yeah.
felt very, very crucial, and it actually came in as a realization because I've traveled down there, understood about their culture, and then came back, and then I was able to pick up those things, those specific nuances, and talk about it. There are certain things which are normal in a particular culture. Let's say, like consuming something which is a habit in that particular culture, realization of that. Usually, a doctor practicing in that locality would
Would
understand
understand.
that, and accordingly, counsel the patient wherever necessary. With these remote consultations happening, that might be missed. So, very, very critical element of that the telemedicine guidelines also emphasize on is to make the doctor aware about what the practice guidelines say, and also the limitations, acceptance of those limitations by the doctor. Like, for example, if a doctor is practicing as a telemedicine doctor, it's not necessary that he has to answer every consultation. Doctor can actually exercise their right of refusal of a telemedicine consultation when they're observing that there is an in-person examination that is required, right?
Yeah.
And these nuances needs to be picked up, and I feel that in today's practice, we had a fast forward adoption of telemedicine during COVID, and post COVID there is a kind of the plateau that you were mentioning is a normalization. In this whole process, this important aspects are being missed out. That's
Understood.
why the awareness and education of the doctors becomes very, very crucial, because at the end of the day, doctor is liable, is responsible for anything that is being provided by them through
So
any mode.
yeah, I think that's a wonderful point. Just to wrap that whole discussion up, there are asynchronous type of telemedicine consults. There are synchronous type of telemedicine transactions, and I think there is one more thing that falls in between these two, right? Which is, I think, remote patient
Yes,
monitoring.
continuous monitoring.
Okay, so what can you just briefly?
So in the remote monitoring, as you mentioned earlier, which is in integral part of the telemedicine platform, which is tele ICU, tele emergency care. These are the kind of models which comes into the remote patient monitoring. There is home care also to an extent, which comes under the remote patient monitoring, where uh, doctor and it actually uses a combination of synchronous and asynchronous.
Got it.
There is a visibility of the patient, whatever is happening with the patient, their bioparameters or their actual symptoms, understanding through different audio video communications, as well as there are devices, like we have glucose monitoring devices, the typical ICU monitoring, whatever happens, right? But that can be provisioned in the remote location, where which a doctor can view and accordingly provide their guidance. So for this,
Understood.
again, it's not required that um, the critical care specialists or super specialists need to be present in that location. So this is where it actually bridges that gap. In rural areas, there might not be presence of critical care specialists or super specialists, there might be a general practitioner or a physician available, or other healthcare professionals available. So they can guide those doctors and provide
Okay.
their observations, their
Perfect. So
view.
synchronous, asynchronous, and hybrid kind of a thing, which is remote monitoring or remote
Yes.
patient monitoring. Uh, just for establishing the clarity, let me put it this way: if I'm a newly registered doctor, or a doctor who was never into telemedicine,
Mm.
and I'm just getting started, first things first, can do I need a high-end microphone and high-end video camera and like in a studio setup to take telemedicine, or what does that require?
Absolutely not. Um, it's very important that we understand what are the minimal requirements. The communication must happen, and you should be visible and audible either side. The background must be clear. You should have a very good appearance. The patient should be able to trust you, right? So you need to have that um, good background, and you should identify yourself. You should take the identification of the patient also. Any microphone that is capturing your voice and transmitting it better, that is enough. As per the platforms, there are multiple platforms that are available. Not to name any private players, you can actually take an example of eSanjeevani, which is the government's platform, and there are a lot of consultations that were conducted through this. I do not remember the number exactly. So that's you as a practitioner can register on that platform and can continue, can provide your services. So visibility and audibility should be good
Understood.
enough.
And a sufficient bandwidth, I
Sufficient
suppose.
bandwidth.
Yeah, got it.
Yes.
So okay, now I'm done with setting my basic white or a neutral background,
Mm.
decent camera, decent audio video, and I am dressed up like a lot of doctor. Can I do I need to tell the patient something extra additional to other consultations? Is there a element that I need to be aware of in comparison to physical that I need to do extra
Mm.
in a teleconsultation?
Yeah. So, like I said, the identification is very important, as I mentioned.
Identification
Uh,
of myself.
Both.
Okay,
So when patient is walking into your office, he knows your designation, your name,
correct.
what are your qualifications and everything. So according to that, he is visiting you for taking the advice. But now when you are visible on a Zoom call or any other platforms, then how would he know that? So it is important that you introduce yourself. You take the identification of the patient. Make sure that if you're seeing some 10 patients in a day, you are actually talking to Meghnath as my patient, and this is his record that you have in front of them. That confirmation would be required. Second important thing, as you mentioned, is age. So if it's a minor, it is very important that you only provide your consultation in the presence of a caregiver,
Got it.
which is 16 years and above. Yeah.
Okay. So anything else? Is that the identification is the only thing that I need to be worried about?
Yes. So another very important aspect, when the patient is initiating a consultation, let's say that I'm making a call to a number which is telemedicine providing number. If a patient is initiating the call, then the consent of the patient is implied.
Got
You
it.
don't need to take it explicitly. But if a doctor is initiating a consultation, whether it's audio or video, then it is important that an explicit consent is taken from the
Okay.
patient. So you need to
Okay.
inform that this is a telemedicine consultation in so way. There are certain limitations to this, and according to that, you'll be providing, continuing the conversation. Explaining about that is important.
Very interesting point that you have mentioned is patient initiating the consult. Okay,
Mm.
so if I'm on a platform where the patient initiates the consult,
Mm.
can I reject it as a
Absolutely, you
doctor?
can.
Okay,
So you will, let's say that you identify a patient with a suspected abdominal tenderness. You you're suspecting an internal bleeding or some laceration to any internal organ or anything. So these are the cases where examination is plays a very crucial role.
Got it.
So you can absolutely refuse the patient if you believe that they would need an in-person consultation.
Okay. With the proper reason cited, I
Proper
suppose.
reasons example, and
Okay.
also it would become important responsibility from our behalf that we also tell what is the other alternative referral that they can probably look into if you are cognizant of that.
Okay. So, okay. Now, all of this, I have done my consultation. I'm ready to give my prescription, for example.
Mm.
Is there a limitation on what drugs I can write, or I can prescribe any drug that can be prescribed in a physical consultation?
So, NMC guidelines and telemedicine practice guidelines categorize the drugs in different ways. There are O, A, B, and non-prescribable drugs. So, prohibited drugs, which is four categories. O is over-the-counter drugs.
I can.
You can walk to the pharmacy directly without a doctor's prescription. These are available. A is these are the medications that you can prescribe during the first consultation itself, which can be a teleconsultation. So all your ointments, drops, eye drops or ear drops, and antibiotics, all of these medications come into this category. But it's very very important that these are only prescribable on a video consultation,
Okay.
not an audio consultation. So audio we have a limitation of only over the counter. The third category is category B. So these are all our anti-diabetic, anti-hypertensive medicines, so something like that. So whenever a patient is consulted first time on a physical interaction, in-person consultation, and the follow-up or longitudinal care of this patient is provided through telemedicine, that is where category B medications can be prescribed. But
Okay.
again, these are only to be prescribed on a video consultation after verification of the previous records of the patient.
I mean, can I change the treatment, or is it like, okay, refill? I think I
Yes,
can write,
yes,
but I cannot change the treatment or add a new diabetic drug or start a new treatment altogether for Schedule B.
yes. So it is important that you understand and certain more detailing which might be necessary in in-person consultation. So as a cautious approach, the guidelines have been formulated in that way that category B can be given on a video follow-up consultation only.
Okay.
Then the fourth category, we are in fourth, right?
Fourth, yeah.
So the fourth category is the prohibited medicine. So the narcotics and psychotropic medications and all the Schedule X medications, which is cancer treatment and the other ones, these fall into the fourth category. These are absolutely prohibited, and at any given point of time and circumstances, these are not to be prescribed by a doctor on a teleconsultation.
Okay. Got it. And I think the impact that I can create through telemedicine will change with the specialty or specialist or super specialist that I am, right?
Mm.
Maybe in fields where history taking is more dominant than examination,
Mm.
psychiatry, maybe to a certain extent, general medicine, and so on, it
Mm.
would still be more impactful.
Mm.
But I suppose that where it is surgical related, the whole efficacy of how telemedicine can be impactful
Correct.
reduces very substantially from the medicine to surgical department point of view.
Correct.
Okay. So when we
So,
talk,
on that note, I also want to mention that there are certain fields of medicine where um, there is a lot of stigma for the public in
Mhm.
terms of actually giving time for those specific medical conditions. In this, we have two major categories: one is mental health, and the second is sexual health. These two are very sensitive areas given any geographical location. I think this is very very important place where telehealth can be a game changer,
yeah,
right?
looks
So
like it. Yeah.
I think I mean from not think I have actually witnessed a lot of impact in sexual health related diseases, where on an audio consultation, patient is actually able to face that stigma, overcome that stigma that I can talk to the doctor because doctor is not able to see me ultimately, and I can
Perfect.
discuss my problems in confidence with them. This is where we have seen a great impact. And this second obviously is mental health. But I would say that despite of having telehealth as one of the mode which can add a significant value, there is still a lot more that we can do in this
Understood.
related
And I
fields.
think, like you rightly mentioned, m- from a counseling point of view, I'll be way more impactful if the counseling related or therapeutic related non-medicine or therapeutic related aspects can
Hmm.
be well addressed through a tele kind of a modality. So
Yes.
you, one of the very good points that you have mentioned is I have to be, as a doctor, I'll have to be aware of the cultural differences between certain state borders. I think that's a very small nuance but very valid point, because what is normal here will not be normal there, or what is normal there will not be
Hmm.
normal here, and how as a doctor I would react and try to respond to the patient on
Hmm.
certain things will change the entire equation. That
Yeah.
is true.
Just
So
to add an example to it, if I may, let's say that you found a patient of who is experiencing dehydration.
mhm,
This is something that we have actually seen, and this patient comes from a North Indian state, extreme north of India. Okay, if the doctor goes ahead and prescribes coconut water, which actually happened in one of the cases that we have seen,
understood. There are
where the hell will the patient find coconut water in northern part of the country, right? This
correct.
is where it's important that you're aware of.
Yeah, makes a lot of sense. So the cultural differences that need to be understood within a country, maybe within this is okay
Hmm.
from, but if the borders are international,
Hmm.
as a doctor, can I consult a patient maybe in Africa or maybe patient in Dubai or US? Is there, other than understanding that cultural differences, is there anything that else that is stopping me from taking that consult?
Regulations.
Okay.
So once you enter into another country's border, then you have to abide by the regulations of that country. If we are talking about any European country, we have it's very highly regulated there. You need to be practicing physician in that locality, licensed in that country, then only you can provide this. So just because the accessibility is enabled because of these platforms, you should not be prescribing medications into another country's border without understanding that. So if as a business entity doctor wants to expand their services in another country, then you can learn about those countries regulations and abide by them. There are a lot of consulting bodies also which can facilitate that. But as a practicing doctor, you found a patient there or someone approached you from another country, then there is a one specific area how you can address is that you can give an opinion to another doctor who is practicing in that locality,
Interesting.
and that doctor is ultimately making a decision for the patient. So in this way the liability would be reduced and you are still abiding by these guidelines.
Okay. Nice. So oh, by the virtue of it, what you are trying to say is telemedicine does not always mean doctor to patient.
Hmm.
It can also be a doctor to patient.
It is much more than that.
Hmm.
So it is doctor to patient, doctor to a patient, doctor to a paramedic to a patient,
Okay.
and doctor to multiple doctors also.
Okay. Nice. Yeah, I think that's perfect and very insightful. Now, if I have to keep the doctor's hat aside and think from a complete entrepreneur or a telemedicine promoter or a tech provider kind of a point of view, where do you think telemedicine has a successful business model? Where does it actually work as a framework?
As a success story, you mean?
Yeah, yeah.
Um, so um, we can probably look at it this way: where there is abundance of availability of the providers, healthcare professionals, And especially in the kind of geographical variability that we have in India, there is non-availability of the healthcare professionals in certain areas. So in places like this, uh, hub and spoke model is a very successful business model that has been implemented using telehealth. So we have hospitals where specialists, super specialists are all present, and that's hub. And there are spokes, which are remote locations present all around the country, let's say. So their services can be extended beyond the capability. How I usually explain this as a benefit for the doctors also, or the facility for this matter, is um, we have a doctor catering to only limited population. Let's say a village, there is a doctor present. He caters to only that village location. Now when we are adding a tele health infrastructure there, his services are extended to maybe nearby villages also, whoever comes to know about that. So that's a one perfect successful model. The second place is where we need to do a lot of public health perspective. Our reach needs to be multifold in a limited period of time, which is screening services. Screening for during the COVID, we have seen the implementation of that. Screening of COVID has been implemented using this, and we have cancer screening, which probably comes into the telehealth, the bigger circle. Cancer screening can be done, chronic diseases can be screened, and these reports can be interpreted by a professional who is present at a different location itself. So that's a very successful implementation, especially in the limited resource availability that we have today. There probably a doctor's presence also might not be required. You can send a lab professional or a
Correct.
nursing paramedic, and they can take care of it. Um, Another successful model would be rare super specialists whose availability is not there in different locations. Probably oncology is one such segment, hematology, and these kind of specialty, super specialities. There are very limited professionals, limited doctors that are there in that super specialities today, but the requirement is there all across the country and the world. This is where there's a huge impact. I think that's where radiology also,
Radiology, pathology, and yeah.
yes, radiology, pathology, where teleread services have are shining brilliantly today.
Yeah, I think very well put, and the benefits are very much obvious, right? I think any uh, person who is completely new also would understand that it is all about, first of all, leveling the playing field, like you
Mm,
rightly mentioned, where high resources to low resources kind of, you are bridging that gap,
mm,
and you are trying to equitable distribution of healthcare resources is one thing. You are obliterating the border inequity in terms of rural places don't get much access to good healthcare and so on. That is a very obvious benefit. Other than that, sometimes for follow-ups, maybe patient does not travel and they take a tele consultation and save a lot of out-of-pocket expenditure and so on. So l-
that was nicely summarized.
yeah, so benefits are pretty much obvious. I think they are some things that people talk about very much, but
Mm,
there is also limitations that to telemedicine that is not much covered. One of the things that I always see with limitations of telemedicine is that it is it never works in a silo. That means without any added ecosystem around it and so on, it's pretty much very congested and limited potential is what I see. So
mm.
what do you see as limitations of telemedicine, and is there any hope for that changing in the future?
Limitations are, like you rightly pointed, if we are just solving the problem of accessibility of the expertise being provided, the teleconsultation part of it, it would not be sufficient. um, how would it actually benefit if we are providing the consultation to the patient and patient is not finding that the availability of those diagnostics or treatment is not happening in that location? It's of no use, right? So it is important that telehealth is not actually strengthening vertically, but it is coming in as a horizontal layer cutting across multiple different um, cares, the primary, secondary, and tertiary care. It should actually be able to provide value in all these segments. So that's where the ecosystem is very, very important. Um, Strengthening the logistics. Um, Probably a pharmacy company, which we are seeing as a trend now, pharmacy company also acquiring another diagnostic provider or consultation providers, and they're expanding the value proposition ultimately that is being provided for them. So these are different ways in which the ecosystem has to be strengthened. But it's not necessary that one player has to build their expertise around everything. That's where integrated model comes into the picture.
Yeah, I think uh, integrated care, like you mentioned, I think is one of the things that is little being spoken about a lot these days, and I see a lot of hope, and I see a lot of promise from integrated care model.
Mm.
For a matter of fact, do not see telemedicine to, like, be just functional on its own, because it's like it's a team play. In into be very in a very layman language, no matter how one good player is, if the team does not come together, how well that player plays does not actually amount to anything much, or does not lead the
Mm.
team to victory. So that's how integrated care models have to be propagated more, where telemedicine is fitting into one of the pieces. Chronic disease management, I think, is a very, very good example, where the initial consultation happens directly with the doctor being in person, but all of the follow-ups, the education, the counseling that needs to happen, all of that happens over telehealth. Or pieces where the hub and spoke model, like you rightly mentioned, where not entirely it is a manless kind of a center, where people are sitting there, people there is a doctor that is sitting there,
Mm.
whose collective decision making power from the hub specialist and
Mm.
also the doctor here is combined in a way affecting the patient or impacting the patient.
Correct.
So these are some things that I think we'll need to focus on more and more, and not look at telemedicine as a silver bullet. I think that's one of my biggest takeaways of not just COVID, but if any time which we worked with telemedicine, it usually, anything for that matter which is new, people try to make it the silver bullet and see how this fits here, how this fits here, how this
In,
fits to every problem that is there within healthcare.
mm.
We should come out of that and have a more purview of which other pieces of the puzzle that it plays really well with.
How
And
can it complement the existing
exactly,
healthcare
exactly.
infrastructure?
So that is something that we should promote more, and we should be seeing happening in the future. So when we talk about the future, where do you think we are going in terms of, is telemedicine actually dead like many people deem it to be? I think companies like Babylon Health and Teladoc Health
Mm.
falling to its ground after that whole surge and all the investments drying up in telemedicine space. Do you, lot of people consider it to be dead or a fad that just passed? Do you really think that's what it is, or what would be the future of telehealth?
I personally do not think that there is no scope for it. But like you mentioned earlier, the existing as an independent service itself, the verticalization, that probably might not be as successful as it can be. I would like to compare it with the only AI doctors or AI services being provided. That might not add a lot of
Nicely put.
impact, value, change, difference that it can create. So it needs to come into the ultimate puzzle as one of the piece, and that's how it will be able to actually see the day. I don't think that market also believes that there is no
Correct.
scope for it. In fact, some of the research papers say that it growed, it is growing at a pace of 20%, projected growth by 2030, and it's in billions.
Yeah, yeah.
Investors also, I believe that they see value in that, but not exclusively like the companies that you mentioned, where there is, um, it's not just the user acquisition that that's
Correct.
a game changer anymore. It's the
Value
ultimate
creation.
lifetime value that we are
Correct.
creating using this, and the
Absolutely.
flexibility that is being built using this as one of the service, one of the
Correct.
weapon in the arsenal. That's where there is still a lot of potential. I think we are not realizing that potential completely as on yet. That's where still, as doctors, I believe that medical college should educate about this also.
Very important.
Telemedicine practice guidelines have to be a part of the education curriculum, for which Telemedicine Society of India is also trying to work towards that. There are student chapters that we are forming in different medical colleges where
Oh,
sensitization is happening at the same time. Um, and then after this comes in the awareness about the regulatory aspect of it. I think all these play a very crucial role for all of us to realize the potential that we can see eventually in this field.
yeah. So I think from a technology standpoint, also the growth, the amount of different innovations that are happening in tech standpoint, that will still accelerate and like give more meaning to telemedicine is what I feel. And one of the statistics that was really interesting for remember, if we are talking about the telehealth demise or is it still alive, is before COVID, the whole percentage of visits that were physical versus how much part of total interactions
Mm.
were telemedicine, it was somewhere around 9 to 10% before COVID. And this is not a study that is specific to India, but
Mm.
on a general spectrum, it was conducted overseas. So it was 9 to 10%. During COVID, it rose to 38 to 45% during peak COVID and so on. Fortunately, after COVID, it did not, like
Going down.
everybody is thinking, it did not drop back to 9 or 10%.
Mm-hmm.
It's minimalized and stayed at a 16 to 17% is what the survey says,
Mm-hmm.
which is a good sign.
Mm.
Like, 16% to 17% of the entire consultations being telemedicine is a good promise. And I see that if we take into consideration the new touch points that can be created,
Mm.
like, you need not maybe come back to the doctor for a report review, you need not come back to the doctor for a refill, you need not come back to the doctor for a post operative like, second post operative check or so, and so on, and you create those more visits happening. This
Mm.
percentage can, I'm hopeful it goes up to 25 to 30% in the future and stabilizes at that. From a tech standpoint, I think I'm very hopeful for those three layers that we're talking about. Communication is going to get very much enhanced.
Mm.
Vernacularity and language barrier is going to become almost obsolete. And the second layer of documentation, doctors need not again sit and write anything after. The audio that was transcribed during the consultation
Mm.
might be good enough for generating clinical orders and prescriptions for that matter. And diagnostic value of, like, pre-consultation or a pre-tele interaction versus post-tele interaction, what all things need to happen, those things might get maybe not replaced by AI but supplemented by
Mm.
AI diagnostics or
Redefined.
self-check or very well optimized triaging systems might come into picture. Very well tested and optimized outcome monitoring systems might come into picture, and the promise of telemedicine will be reignited for sure. It will never go back to maybe COVID kind of a thing, but there is a good scope that can be promoted, and doctors, like you rightly mentioned, knowing about it, and I think understanding when to rely on it and when not to rely on it is very, very much key. And patients will, more or less, I think patients are still forward in this race in terms of
the demand.
Yeah, the demand is there, and the digitization is accelerating at a superbly good phase.
And very important driving factor on the patient front is the convenience.
Correct.
Patients are looking at convenience in everything, so telemedicine is also,
yeah, but that is true, but there are actually very much contradictory opinions, because there is also a rise of doc patient wanting that physical, like in presence kind of an interaction with a doctor after the whole boom of social media and so on. Maybe we should actually talk about what is the impact of social media and all that in one of our discussions. Where the aftermath of that is, many patients, at least some have seen in my family, they don't like talking to the doctor on call. So it needs to be that's the reason I'm saying it, on the longitudinal care timeline, telemedicine needs to be few of the dots.
Correct.
It cannot be the entire line. That's how we will have to walk the system towards that picture, where I'm seeing my maybe endocrinologist now. I'm showing him the reports. I'm starting the treatment. I'm somewhere in a remote place. Rather than coming every month for his checkup, I can just have a teleconsultation and still pay the same fee, because I'm saving on my travel cost. I'm saving on my time and so on, and benefit for me and the doctor both. So those kind of things have to be propagated more.
Yes, absolutely. So I think it's a very vast subject, and I feel like talking about this even more and covering a lot more aspects on this. But maybe we can have a part 2 of this conversation where we are also talking about what the government is doing around this.
Yeah, but we should definitely have a separate discussion on United Health Interface and ABDM, and what does it explain, all of not just telemedicine but the India's healthcare ecosystem for that matter.
Yes. So let's continue that during our next conversation maybe.
Wonderful.